today's today the topic will be basic nursing. Am I audible? Am I audible? Yes. So it's a request from my side. If you can unmute yourself and you can talk so that it can be an interactive session. I know you will be more familiar or more like you will be more uh, having more to type it, right, to chat it. But it is my sincere request that if you can unmute yourself and you can talk, that will be more good and more interactive, right? So today the topic is today's session, which we are going to deal with, is basic nursing care, bedridden patient, or basic nursing issues. So I would like to ask, what are the basic nursing issues you are getting in your setting? Or general idea regarding basic nursing issues?
Hello.
Yeah, tell me.
In sometimes in communicable disease spreading time, we can loss of equipments. No more equipments is essential for nursing care. That the mask, face shield. Hello. Hello.
Okay, I understand what you are saying. You are saying as in order to do the nursing issues, the equipment has to be worked in an effective way, right?
Yes. Yes.
So before going to the equipment, I would like to know that what are the basic nursing issues you are dealing with when you are getting in touch with the patient. So while you are doing a patient care, you have to focus on the patient care first.
Okay.
Yeah. So what will be the nursing issues in that?
Care issues, some problems like patients and nurses, some type of care issues.
What kind of care you provide? You're getting into right point. What kind of care you are providing to the patient?
We can care for nursing, arranging, giving medication.
Basic
Hello?
care, basic cares, daily cares, head to toe cares.
Basic care, like basic care, life support care.
Head to toe care. So I have given you a hint. Okay, other than
Okay.
Vishnu can also, the rest of the people can also unmute yourself and chat. Otherwise, you can chat or you can talk. Okay, so I have given a hint, head to toe care. So what are the head to toe care which you are providing as a
Complete
nurse?
care.
Complete care, that is head to toe care. What are the cares?
Ma'am, hello.
Yeah.
Ma'am, shall I tell you? Ma'am, combing, then mouthwash, then bed bath.
Yeah.
Sometimes applications, madam, any oil applications, powder applications. Then based on if the patient complaining pain, pain relief methods are
Is right. You have said right. What all things like you have pointed out is correct. So we will be getting into the slides, right? So basic nursing issues. Why it is need in the palliative care is whenever we are dealing with the patient in a palliative care setting, the patient will be either having a terminally ill patient or the patient will be in a long-term bedridden patients, right? The patient itself would not be able to care for themselves, and also paraplegic patients, these kind of patients are more in need of getting basic nursing care, right? So we have to focus on that patients, and in our palliative care setting, we have to even educate the caregiver regarding the basic nursing care, basic care the patient needed, right? Okay, so we will get into the slide. So what are the principles when we are caring for a bedridden patient is to prevent the health complications, right? So what kind of health complications we are mainly suggesting? If a bedridden patient, the bedridden patient, you are going into a home visit, or the patient is coming to the hospital, so it is a bedridden patient, so they can come in the wheelchair, right? Stretchers, right? So how you can prevent health related complications, or what kind of health complications they will be getting?
Sometimes
Bed
saturation,
sore.
will
Yes.
reduce the saturation. We will give the oxygen. Through the oxygen, we will come in the fracture, madam.
Health related complications means the patient, if bedridden for a long time, the complications like the skin integrity will be impaired, right? So the bed sore can happen. So, and also the patient can get long, if the care is not proper, the patient can get urinary tract infection. The patient is bedridden, so he will be having catheter. He will be catheter will be in situ, right? So he can get into urinary tract infection. So these kind of if we are caring properly, or we are providing a good nursing care to the patient, we can prevent health related complications. Even we can promote comfort. So when complications are relieved, comfort will be ensured. And also the patient itself, even if the patient is bedridden, the patient will build confidence in himself, right? And also prevent isolation. So what happens if the patient is bedridden for a long time? He is doing passing motion itself in the bed, and also passing urine in the bed. The visitors will be coming or to see him or not? Visitors will come or not to see that patient, that kind of patient?
Come.
No. Why? Foul smell. The patient will be smelling for a long time, right? And what will the neighbors will say, that patient is bedridden, or so and so he is having bedridden because of so and so disease. Don't go there, you will also catch the disease, right? This is what happening, isn't it?
Yes.
Yes. If someone can't respond by unmuting, you can chat also. Let it be an interactive, because it's a like kind of a topic which needs interactive session, right? And we have to improve quality of life. So in order to improve quality of life, we have to touch all the four aspects of the patient, that is physical aspect, social aspect, and physical, social, and what are the four aspects?
Spiritual aspect, madam.
And spiritual, physical, social, and psychological. These are the four aspects in which we have to deal with in order to improve the quality of life. Is it clear?
Yes, ma'am.
Is it clear? You can respond in the chat box also. So once I will get a 2-3 reply, I'll go with the next slide. Okay, thank you so much for responding. Okay, so these are the basic principle. What are to prevent the complication, to prevent comfort, to build the confidence, to prevent isolation, and also improve the quality of life. So what are the basic needs of the patient? As we have already gathered the idea, that is we have to provide head to toe care. So what are the important cares which we have to focus is oral care, skin care, eye care, ear and nose care, hair care, perineal care, and nail care. Okay, so oral care, in order to get a good oral care, that is like if we are ensuring a good oral care, that is equal to overall health, right? So why we are saying it oral care is equal to overall health?
It's come smell.
Yeah, foul smell can be prevented. So if you will ensure an oral care, your appetite will be improved or not improved?
Improved.
Improved, yeah. So you will get taste of your food, what you are eating, right? So overall health is oral care is, we say it as an overall health. We can improve overall health by ensuring oral care itself, right? So what are the purpose of oral care? So we know that mouth is an excellent incubator of growth of bacteria. So hygiene practice has to be maintained in order to make our mouth, teeth, gum, and lips healthy, right? So, and also when we are doing an oral care, we can remove the food particles that may be or likely the medium of bacterial growth. We say a small bit of food products in the mouth that will lead to foul smelling, and that will lead to bacterial colonization, and also that will lead to growth of the bacteria, and also keep the lip and mucosa soft, clean, intact, and moist, and also promote comfort. Right. So these are the purposes. Next. And improving nutritional status by enhancing appetite. As I said, when mouth will be good, in a good condition, or it will be clean, the automatically we will have, why? The salivation is there, na? The salivation process, first digestion process takes place in the mouth. So whenever we chew something, or it tastes good whenever we keep something in the mouth. So the taste will be gathered only when the oral care will be good. So when we chew the food, the digestion process will enhance, the saliva will go into the digestive tract, and then the reaction will take place, right? That we know. So in order to enhance that appetite, we have to keep our mouth clean, and also stimulate the blood circulation of the gum, thus maintaining healthy firmness, and elevate the sources of unpleasant odor. As one of among you have also already said, the foul smell has to be removed. So eliminate the source of unpleasant odor and prevent dental caries. Right. So when the accumulation of these all food products comes, the dental caries problem will also continue. So if we are doing a good oral care, dental caries problem can be prevented. Right. Hope it is clear.
Yes, ma'am.
Thank you. So what are the common problems? Mouth related common problems.
Gum bleeding.
Mouth ulcers, gingivitis,
Okay, good.
gingivitis, bleeding from the gums, then caries, foul smelling.
Okay, thank you for your response. So we'll get into the topic. The common oral problems are, first is dry mouth or painful mouth. So dry mouth comes when that can be because of the side effect of the any medications, and or we know that antibiotic or any kind of opioids we use, dry mouth is a common side effect. So dry mouth can happen, painful mouth can happen, and also halitosis, that is bad breath smell. Okay. And also candidiasis, that is fungal infection, that is candidiasis albicans will be there. That kind of bacterial growth will lead to candidiasis, and also fungal growth, and also oral mucositis. Oral mucositis means the mucus layer of the oral cavity will be inflamed, and also there will be altered in the taste. We know whenever a single ulcer comes in our mouth, right? So what will happen? We will have pain. We will have either we will have salivation excess, but in this the oral the main aspect will be dry mouth. Okay, and alteration in the taste will be there, and also excessive salivation will be there, right? So these are the images. Xerostomia, that is you can see that the tongue is inflamed, and also candidiasis. And also candidiasis, it will be a curd like patches, right? The patches will be there, fungal patches will be there. Candidian albicans is the main name that is said. That white patches or curd like patches will be visible in the palate or any mucosal layer of the mouth, right? Or in the tongue, as it is seen in the image. And halitosis, that is bad breath or foul smelling breath, and also mucositis, that is the mucosal layer will be inflamed, right? So who needs mouth care? Everybody needs mouth care. Who needs mouth care? The patient who are terminally ill, the patient who are bedridden, right? Right. So terminally ill patient, unconscious patient, patients breathing through mouth, post-operative patients, patient with infection and disease of the mouth, patient on nasogastric tube feeding. Right. So who needs mouth care? Someone can say. Bedridden patient. Okay. Preeti has replied bedridden patient. Terminally ill patient. Jyoti has replied terminally ill patient. Post-op patient. Okay. Who is having rice tube feeding? That patient needs oral care?
Yes.
Yes. Okay. And who all needs oral care? The person who is breathing through mouth, right? The person who is breathing through mouth, we can say the ventilator patients, they also need unconscious patients. They also need oral care, right? So what are the assessments when we are doing before doing an oral care? We have to assess the mouth first, right? So what all thing you will assess? We should check for the cracked lip, right? Cracked lip, the lips are cracked or not, dry and coated tongue. So in order to find out there is an oral thrush present or not, that is Candida albicans and fungal infection, right? And also white curd-like patches, that is the description of that disease. Then ulcer in the mouth, any redness in the mouth, any ulcer in the mouth, any bleeding in the mouth, any pain in the mouth, and also difficulty in swallowing or chewing, right? And also difficulty like having anorexia, poor appetite, unpleasant smell, and medical history and the treatment history. Why we need a treatment history? Why we are saying that you have to assess for the treatment history?
Medicines
Yeah.
side effects are bleeding.
Yes, because certain medicine side effects can have dry mouth, or it can also cause stomatitis, xerostomia, or it can lead to bleeding. At last, it will be ulceration and following to the bleeding, right? So these are the assessment things when we are going for an oral care. Before that, we have to assess these things. Okay, so for an oral mouth care, what are the solutions we use? We know that in our palliative care setting, we cannot tell the patient that they cannot even use the brush, right? Or the paste, because paste can also lead to dryness of the mouth, right? So we cannot suggest the paste. So what we can do is we can tell them first to make a homemade saline, right? So homemade saline, how we can make? We can use water or 0.9% sodium chloride. That is homemade saline. We have to make that. What is the preparation steps? That is, we have to take 500 ml water plus 1 teaspoon of common salt, and that we have to boil it, cool it down, and cover it with the lid, right? And use it as per need, right? And also the other option is we can use soda bicarb. So the preparation of soda bicarb solution is 500 ml water plus 1/4 of teaspoon of baking soda, right? Okay, so Jaya has replied that because radiation therapy can also cause oral problems, right? Okay, radiation, what will happen in the radiation? It will lead to dryness of the if it is near to the neck or near to the breast area, the dryness of the mouth, that is the first side effect, right? So radiation side effects will be leading. So in that, one of the side effects is dry mouth, right? Or it can also cause ulceration also, right? So so we'll come back to our topic, that is solution used for the mouth care is water. In order to make the home care saline, we have to do 500 ml water we have to take, and also we have to take 1 teaspoon of common salt, right? And we have to boil it, cool it, and cover it with the lid until we have to use it, right? Use it until it is emptied, right? And also but you have to ensure that you have to cover it. So whenever we are going for a home visit, we have to suggest a caregiver how to make this kind of oral homemade saline solution, right? And also other options, that is adding a soda bicarb. So how we can prepare the soda bicarb? 500 ml of water plus 1/4 of the teaspoon of baking soda. So whenever there is a patient in the inpatient department, what we can say, you can use a cup of water, means 250 ml of water they can take, a pinch of salt and a pinch of baking soda, mix it and give it to the patient with the help of a like they can use a spoon covered with spoon's handle covered with gauze and dip it and clean it, right? Or that handle can be used as a device to open the mouth one side in an unconscious patient, and then do another same type. We can make the spoon and clean the mouth, right? Or we can use some kind of lollipop kind of thing is also coming nowadays, that can also be used, right? So is it clear how to make a solution for the mouth care?
Yes, ma'am.
Only one reply. Okay, one chat reply, yes, thank you. Then so your response is also evaluated. We have to get into an interactive session. So you have to reply. Is it clear how to make a homemade solution? This is very important when we go for an home visit, or because we know our patient cannot afford NS bottle. It's costlier, right? So we have to tell them how to make a homemade solution, saline solution, right? So I think it's clear. Now we'll get into the another slide. That is self-care education. What all are the self-care educations? We have to advise the patient to brush the teeth twice a day with a soft bristles, right? Or a soft toothbrush. And also toothpaste left in the mouth can cause dryness. We have to tell them to rinse thoroughly the mouth 3-4 times, so that the toothpaste used has to be removed from the mouth. Otherwise, it will cause dryness. And also rinse the mouth. We have to tell the mouth continuously 3-4 times to rinse the mouth with the homemade saline or soda bicarb solution, and tongue to be brushed with soft brush. And we have to advise the patient to drink plenty of fluids, because hydration is very important. And pineapple, we can suggest pineapple also, but pineapple is a like pineapple has also contain a mouth cleansing enzyme, which is a salivary stimulant, and however it is acidic in nature. So ulcer patients can cause some problem, but it is advisable that if we use a pineapple, it can stimulate the salivary glands, and the pineapple has got an enzyme that can cleanse the mouth, right? And dentures should be removed at night. So the patient who are using dentures, we have to advise them to remove the dentures at the night, keep it in the water, clean it and keep it in the water, and very next day they can use it by cleaning the mouth. Before cleaning, they should not use the dentures. They have to clean the mouth. Then after that, they have to use the dentures. Okay. So the procedure for patient requiring assistance, what all things we'll do? First, we have to, before doing a procedure, we have to explain the procedure to the patient. We have to ensure privacy. That is very important. We have to provide semi-follows position or follows position, semi or semi-follows position to the patient if not contraindicated. And place a towel under the chin and over the bedding area. So if we are doing a care for a patient who is unconscious, we have to provide a sideline position, and we have to keep a draw sheet or a towel under the sidelined position below the cheek, right? And also we have to pour the water over the brush and place the dentifrice on it. Then encourage the patient to rinse his mouth frequently and remove and clean the equipment. Wash your hands. Document the time, solution use, and condition of the oral cavity. Right? So whenever we are doing a procedure, you have to do what we have to do. First, we have to explain the procedure. We have to ensure the privacy. We are learning it from the day one when we join the nursing, right? So explain the procedure. Then you all have to do the procedure comfortably to the patient. Then finally, the end thing is you have to wash your hands, document it. What are the solution, any kind of assessment things you have noticed it while doing the oral care, right? And the document the time, which is very important, and the condition of the oral cavity, right? Next is procedures for a terminally ill patient. What are the articles? Because we know that whenever we go in a home care setting, the articles will be different comparatively to the hospital setting. So hospital setting, we have artery forcer, we have tongue depressor, we have gauze paste, we have normal saline, we have small Macintosh, face towel, clean water and swab sticks and kidney tray, right? I think you can agree with these points, right? And in the home care setting, we need a spoon or an ice cream stick, right? A spoon, why? Because in the spoon handle we can roll the gauze and we can use it to clean it, right? Or we can even use it one or more spoon to keep it to open the mouth of a patient who is unconscious, right? And also clean cotton cloth or gauze piece, homemade saline, plastic sheet, face towel, clean water, swab stick, and kidney tray, right? And what a lollipop kind of thing I said, that is a sponge with a stick which is attached with a sponge that is already pink color. It is given in the image. You can see in the tray. In the image tray, there is a pink thing which is shown, right? Right. So the procedure for a terminally ill patient. So whenever we are attending a terminally ill patient, even the patient is unconscious also, we can tell the patient that we are so and so, we are going to do the procedure, because they can hear at least, right? So whenever we touch a patient, we have to tell, like we need to ensure that we have said something what we are going to do to the patient, because they cannot respond, but they can at least slightly hear it, right? So explain the procedure to the patient, provide privacy, place a small towel with the face under the head, face towel under the head, semi-follows position, or the head turns towards the side, right? In order to prevent aspiration also, right? And also use a padded tongue blade to open the patient mouth and separate the upper and lower teeth. Soak the cotton balls in the homemade saline and squeeze it to remove the excess water. And after that, this is the main points which you have to remember. While we are cleaning the teeth, we have to clean it lower chewing surface, okay, inner side and outer side. Got it? Lower chewing surface, inner side and outer side. Then upper chewing surface, inner side and outer side. These all procedure are done in a single stroke manner. Do not rub it, right? And also clean the oral cavity from proximal to distal using one gauze piece for each stroke. Clean with normal water, lubricate the lips using soap stick, document the time, solution use, condition of the oral cavity, and any abnormalities noticed and the patient's response, right? So these are the important things. So whenever you will be asked about the oral care, I know you will say the procedure and all, but you have to remember the technique. So how is the technique? Lower chewing surface, inner side, outer side. Upper chewing surface, inner side and outer side. Got it? Next, what are the common lubricants which we are using? That is liquid paraffin, coconut oil, ghee oil, or Vaseline. So these add moisture, right? So dry skin, whenever we apply it, these add moisture. So we will see a video, that is how we have to do an oral care. Okay, so this is the oral, how we have to do the oral care. A slide video which will be helpful to remember you and give a good oral care to your patients, right? Okay, so next we'll go to the next slide. Okay, so care of the eyes. Any idea how you provide a eye care? When I said any ideas, 2-3 videos got off.
Madam, lukewarm water, madam.
Okay. Any kind of problems in the eyes? Okay. Then important things you have to remember, as we are doing an oral care, we have to remember that lower chewing surface, inner side, outer side, right? So same as eye is also having a criteria to clean the eyes. How it is? How you draw a kajal?
Inner canthus to outer canthus.
Very good. So we have to clean it from the inner canthus to the outer canthus in a single stroke manner, right? So first of all, whenever we are doing a procedure, we have to explain the procedure to the patient, provide a comfortable position, wash hands, clean the eyelids and eyelashes with a wet swab. As we are going to clean, what will happen? Dried pus like things will be there in the eyes, right? So we have to clean the lid and eyelashes with the wet swab. Wipe the lid from inner canthus to the outer canthus. Use one swab for one stroke in one stroke manner, and also documentation is important, right? Next, care of nose and ear. How we will care it? First, we have to explain the procedure to the patient. Remove the secretions from the nostrils. Then wet, wash clothes or a cotton applicator moisten with normal saline or water. Check for any dirt accumulated behind the ear. So nose, once we are clearing it, we have to check whether any kind of bleeding or any kind of pus formation or pimple like things or redness is there or not, right? So after that, we have to clean it with a moistened or a normal saline, dip the gauze and clean it, or a wet cloth, right? Or a cotton. We have to clean it. That's a simple procedure. Then ear, we have to ensure we will look for the front portion only, right? So whenever we are doing caring for the patient, we have to remember the dirt will be accumulated behind the ears. So we have to clean behind the ears, front of the ear, and also we have to check for any wax in the ear that can cause even hearing problem, right? Okay, next is care of hair. So someone can tell me how you provide a hair care to the patient. I know you will be having a flashback when you have done this procedure in the BSc first year or GNM first year, right? Isn't it? Yeah. So you can recall your memory and you can tell how you would have given a hair care, or you are giving a hair care in a patient who is hospitalized or bedridden. Any special thing that we have to remember? It's already given in the image and then only I'm asking it so that I'll get a little bit of response. Head bath, Lily said head bath. So I am telling that you remember any special thing which we have to focus while we are doing a hair care or a hair bath.
Lie down the patient, ma'am.
Okay, so when we are doing a hair bath, we have to tell the patient to lie down and ear plugs. That is very important. Whenever we are doing as it is given in the second image, right? So whenever we pour the water, it can go into the ear, right? So we have to close the ear, right, with a cotton ball, right? And then we have to provide the hair care. So whenever we are doing a hair care, we have to divide the hair into two portions. So that will be more easier, right? So these are the important things you have to remember whenever we are doing a hair care. Just combing a hair is okay. Entangling is okay. Entangling, just divide the hairs into portions and entangle it. But when we are giving a hair bath, at that time we are washing the hair, right, with the water. So whenever we keep the patient in this supine position, we have to ensure that the water will not get into the face or any neck area or shoulder area, right? So we have to, under the head, we have to keep a draw sheet. Then we have to cover the chin area also, right? And also we have to use the cotton balls in the ear, right? So these are the important things. Then you have to divide the hair into two portions and provide the care. That is okay, right? So these are the important things you have to remember. So we have to explain the procedure to the patient. We have to provide, also help the patient to move his or her head towards the edge of the bed and remove the pillow. This is also an important point. Protect the bed linen and pillow cover with a towel or a Macintosh. Insert the cotton balls in the ear. Place a Macintosh under the patient's head and neck. Keep one of the end of the Macintosh in the bucket to prevent in order to receive the water, right? And also wash thoroughly with soap and shampoo. Rinse thoroughly and dry the hair. Braid the hair into two or one each side of the head, right? Then remove the cotton balls from the ear. This is also important. Whenever we are in a stress of doing an hair care, we remove the cotton balls and we go. When the invigilator calls us, we'll remove the cotton balls, right? So we have to remember it. Now we are into say we are into a earning practice, right? We are the permanent staffs of organization. So we have to remember these little points, right? So nail care, how we'll do a nail care? We have to first, so any ideas how you do a nail care?
First, give the soaking.
Yeah, very good. That is very important. Why we suggest for soaking?
It comes to soft.
In order to soften nails, right?
And
So who needs nail care most? Which patient needs nail care the most?
bedridden patient, skin
Why?
disease patients.
Why? Because they will do an itching, right? They will scratch the skin and that can lead to skin laceration, and that can even worsen the condition and lead to bed sore, right? So nail care is very important. So we have to explain the procedure to the patient and also assemble the articles, place the rubber sheet under the patient's head or leg, soak the finger in the warm water for 5 minutes and cut the edges of the nail. This is also very important. We have to cut the edges of the nails, right? And also encourage the caregiver to provide nail care frequently, right? Whenever needed. Next. Then bed bath. So whenever we are doing a bed bath, why we are doing a bed bath? Very important in order to maintain a and promote the hygiene. So these are the objective which we follow for a bed bath is we have to clean the dirt of the body. We have to increase elimination of the waste through the skin. We have to improve the circulation. We have to induce sleep. We know na, when we are in a hectic schedule, we'll go to home and we'll do a bed bath. We'll do a bathing, right? So that will refresh ourselves. So same like the patient also, and we'll get a good sleep. So in order to induce sleep also, providing bed bath for the patient who is bedridden is very important to give the patient a sense of well-being and also to regulate the body temperature. Next, the procedure. So what is the thing which is important to consider while we are giving a bed bath? Something we have to remember, important points, as I said, in the eye care, in the nail care. Do you remember?
Perineal care.
Okay, that's a particular part, right? So when we are doing a bed bath, we have to, importantly, that is where we are exposing to clean the area, that part has to be exposed, rest has to be covered. That is also important. Barely removing all the clothes and providing a bed bath is not recommended, right? So what we have to follow, as it is written in the slide also, maintain a privacy, provide the, explain the procedure. All the equipment should be in the side, at least in the conveniently placed in the hand side, and also the temperature of the water should be adjusted for the comfort of the patient. This is also very important. We have to check the temperature. Then keep the patient near the edge of the bed to avoid overreaching and straining of the back of the caregiver. And only small area of the body should be exposed and bathed at a time. Okay, this is the important point which we have to focus. That is, only small area of the body should be exposed. While we are exposing, that exposed part should be cleaned and rest of the part should be covered, right? So once you are exposing a part, that first clean it, then cover it. Then next part, clean it, cover it. So we'll start from the upper to the lower, right? And remove the soap completely from the body to avoid the drying effect. Cleaning is done from the cleanest area to the least cleanest area. Okay, that is upper part of the body should be cleaned before the lower part of the body. So upper will be the cleanest area, lower part will be the least cleanest area. And also wash the hand and feet by immersing both in a basin of water because it promotes thorough cleansing of the nail, fingernail and toenails. A thorough inspection of the skin, especially at the back of the body, should be done to find out the early signs of pressure sore. Okay, so whenever we are giving a bed bath to the patient, we have to specially be vigilant that we will monitor the bony prominence area, right? So these bony prominence can lead to like impaired circulation and the bed sore can happen. So early signs of bed sores can be ruled out when we are doing a bed bath also. Then apply moisturizing cream and massage at least 3 to 5 minutes. So when we started the class, somebody has said that we can use the powder. Okay, so that powder has got a rough surface, na? So mostly we don't, and also it can lead to dryness. So we don't recommend powders. We mostly prefer white petroleum jelly, or we can use a coconut oil. We can use Vaseline. even ghee is also not promoted in the hospital setting. In the home care setting, they can do it, right? But in our setting, we have to mostly focus on the white petroleum jelly or Vaseline, or liquid paraffin is also good, or coconut oil, simple. Okay, then remove this. Okay, so these are the next is these are the procedures or the steps we have to follow for the bed bath. Next is back care, right? So back care, special attention to the pressure point. So whenever we are doing a back care, the important point we have to remember is we have to give special attention to the pressure point. Why pressure points? Why we have to give a special attention to this pressure point?
Making ulcer.
Bed sores will come easily, ma'am.
Yeah.
Circulation.
Yeah, because of impaired circulation, as that bony prominence will be compressed, that can lead to improper circulation and that can lead to bed sore, right? So we have to, and also we have to encourage that the back care is every 2 hourly, right? And also lather soap by sponge towel, wipe and soap and rinse with the plain water. Dry the area by patting, not by rubbing. Why? The skin are all like the protein intake will be less. The skin integrity will be very poor. So if you are going to rub that area, all the skin will be removed from that area and we will get a stage 1 bed sore, right? So what we have to do, stage 1 to 2, right? So what we have to do, we have to pat dry, right? And also apply moisturizing cream. So cream is most preferred than powder. Then massage at least 3 to 5 minutes, and massaging helps to increase the blood circulation and also prevent the bed sore. Is it clear?
Yes, ma'am.
Okay, so bed sore prevention, we have to mostly consider every 2 hours, at least 2 hour position change, right? Then we have to promote active and passive exercise. Can anyone suggest why we are telling the patient to do active and passive exercises?
Stimulate the blood
Muscle
circulation and easily movement and reduce the flexion, stiffness, mainly circulation.
Okay, improve the circulation. Okay, contractures. You have heard about contractures? Stiffening. That the patient is in a particular moment position for a long bedridden for a long time, what will happen? The joints will not be able to fold that joint, right? If we will try to fold the hands or legs, the patient's joint will not fold. Why? Because the contractures will be developed or the bone will be very stiff. So in order to prevent that, we have to promote active and passive exercise. Active exercise means the patient itself can do certain small types of exercises. Passive means with the help of the caregiver, the patient will be able to do certain like joint exercises, like patient is bedridden, patient is or paralysis patient is not able to fold the legs, right? So what we can do, we'll take the help of the caregiver and we can fold the legs and then keep it straight like that, right? So exercise must be integrated into the patient's daily life, and as it prevents contractures, foot drop and waist drop, right? So foot drop, waist drop means whenever we are not using that part, that will be the blood circulation will be impaired and that will not be having any kind of like control over the body. Then all the joint needs physiotherapy. Educate the family the importance of exercise to prevent joint stiffness. Okay, Preeti is typing active to do by the patient and passive with the help of the another person. Right. I think I have said the same thing, right? I have said the same thing, right, Preeti? Okay, anyone can reply. I have said the same thing, right? Active means that the patient is actively doing. Passive means with the help of the caregiver. Yeah, yes, thank you. Okay. Okay, so next we'll come to the procedures. So we know catheterization is a procedure or catheterization is a, yes? Okay, so catheterization, what we are doing, a Foley's catheter is a sterile tube that is inserted through the urethra into the bladder to drain the urine, right? So we are inducing a sterile tube that is made up of a latex or rubber tube or a silicone tube. We are inserting through the urethra into the bladder to drain the urine, right? So these are the parts of Foley's catheter, that is there is a from tips. Tip we will start. There will be a balloon opening, a bladder opening, and also a balloon will be there. And when we come to the lumen part, there will be a size will be mentioned, and also urine drainage port will be there, and also balloon port will be there. That is, through that we will be inducing 10 ml or 15 ml distilled water, so that to inflate the balloon, right?
Yes, ma'am.
Yeah. Next. Right. So what are the types of catheterization? We know there is an indwelling catheterization. Indwelling catheterization also we have two types. What? It can be silicone or it can be Foley's catheter, that is made up of latex. Then indwelling suprapubic catheterization. Indwelling suprapubic catheterization means directly we are putting a tube into the abdomen towards the bladder. That is direct hold from the abdomen towards the bladder, and we are putting a tube, right? Putting the catheter in order to drain the urine. And also clean intermittent self-catheterization, that is a NEL cath, which is used of different size, 12 and 14 and all, as per the right? So the clean intermittent self-catheterization, the patients who are paraplegic, they can use it in a particular 3-hourly or 4-hourly manner. They can maintain their bladder pattern, right? And also quantum catheterization is also there. The person who has got night like problem of night urination or night micturition, right? So that persons we can offer quantum catheterization. Or the person who is paraplegic and night time they are not able to use the ICC, intermittent self catheterization, they can go with the quantum catheterization at the night, right? So these are the like as I explained it, suprapubic is directly from the abdomen. We are putting a hole into the urinary bladder, and the tube, Foley's tube is attached, right? And also the drainage bag is attached. Then important thing you have to see in the image, that when we are putting a Foley's catheter, we have to stick it in the upper aspect of the thigh in order to prevent, by positioning and on, we can prevent the displacement, right? And also, yeah, that's it. Next is procedure. How we'll do the procedure? Take all the sterile precautions. That is very important. Whenever we are doing a catheterization procedure, we have to focus on sterile procedure. Then close the smallest, choose the smallest size of the catheter. What is the smallest size? That is adult. It will start from 14 French F and 16 F and 18 F. Then lubricate generously and wait. It is important to ensure that the bulb is in the bladder. And also how much to inflate? 10 ml to the much you can use the bladder. Mainly we prefer 10 to 15 only, not more than that. But for a patient who is very much big, oversized and obese, we can go forward with the more also. Then spasm, but we will prefer not to give more. Why? Because it can cause bladder spasm. Too much can cause bladder spasm, right? This is very important. Whatever points I'm telling you to highlight, that will be like you can get the questions in the end of your exam, right? So 10 ml, not more than that. What happened? It will lead to bladder spasm. Then antibiotic prophylaxis for urinary catheter insertion is not recommended. So some patients will come and say that once you are putting a catheter, you have to give me a antibiotic shot. Why? Because I can go into urinary tract infection. So whenever the patient who is saying that, we have to tell them and educate them that putting a catheter does not lead to an urinary tract infection. But if you are not doing a proper care, that can also lead to, and you are not taking a good amount of fluid, then that can even lead to an urinary tract infection, right? Then clean intermittent catheterization or NEL cath, we use it. So whenever we do, we encourage doing clean intermittent catheterization, we have to maintain privacy, wash the hand, position according to the comfort and level of the patient. NEL cath size should be 12 Frenches, and lubricate the tip before insertion. That is very important. Lubricate the tip before insertion. Time interval is every 4 hours. Clean the NEL cath under running water and keep it dry in a clean container. Okay, so once used, can be used in the, like if the person is having 3 NEL cath, morning they can use it, then evening they can use it, and evening also new. But the first one that we use should be in the next morning. Same way, if the patient is having only 2 NEL cath, right? because it is costly also. Some patient cannot afford that also. So the quantity of Nelcare which will given by the hospital will be only 2. So how the patient will be managing? So we have to educate them that when you are using 2, one day, first day they will not be having any problem. 2 Nelcat is there. But when and 4 hourly they have to do. So once used should be cleaned, dried and kept it in the container. Then second used while before second use second Nelcat. Then third time while the patient is using the first one, it should be earlierly cleaned. After using it should be cleaned, dried and put it in the airtight container, right? Clean container. Okay, so what are the advantages? We can improve the quality of life. As we have said that overall care we are focusing, we are focusing in order to ensure quality of life, increase self-esteem and confidence, easy to use, inexpensive, reduce the risk of infection and improve sexual hygiene. Okay, so the advantage of intermittent catheterization will be weighing with the Foley's catheter. So what are the exact advantages while we are using intermittent? Quality of life can be improved by, because the Foley's catheter patient, they have to carry the bag also wherever they are going. So that will be having a social isolation kind of things. Now patient will not be more like happy to see that the patient, everybody in the outside will be focusing on that patient, that oh, he's having a tube and he's having a bag in which urine is collecting, and they will be staring with that continuously in that patient, right? So in order to avoid that, we can suggest intermittent catheterization so that they can improve the self-esteem and confidence, easy to use, inexpensive, reduce the risk of infection and improve the sexual life. Right. So how the condom catheterization used, as it is seen in the image, the condom catheter is a condom sized condom sized. The catheter will be a shape of condom, and the tip of the part will be attached to the urine bag, right? And there is a sticker, right, given. So that sticker will be wrapped on that when we fix that condom catheter in the penis of the client, we have to give a stick. That is, we have to tape it with the above that condom catheter, right? Does not have to touch the skin, because that is very sensitive area. While you will remove it, the skin will be teared off, right? Next is, what are the advantages and disadvantage? Both it has. That is, less catheter associated urinary tract infection, more comfortable than indwelling catheter, less movement restriction, non-invasive, nothing is inserted into the body. Then what are the disadvantages? First is leakage, because the proper size will not be there. The first thing can happen is, because of the wrong size, leakage will be there. Skin irritation will be there, breakdown from the urine breakdown and from the urine leakage, more likely to fall off or leak than internal catheters, and allergic reaction. Why? Because as we know, in the condom also the latex is used. The latex rubber thing which is using is the latex, so that can cause latex allergy, right? So that in order to prevent, the main disadvantage of condom catheterization is allergic reaction that can lead to, because of latex plastic, right? Rubber, right? Condom. Next. So I hope you have cleared the points which I have said. You don't have any doubt. So we'll go into a case scenario. That is, a home care unit of the hospital made a visit and found that the patient was having pericatheter leak. Okay. So they changed the catheter. The next day, the carer noticed that the pericatheter leak was still persisting. She called them again and they came and changed the catheter. Okay, again the next day the same happened, and once again the catheter was changed. So the catheter was changed 3 times, but the problem does not solve. So what can we suggest?
Size.
Hmm. Okay. So what we can do is, the home care unit, the hospital made a visit, found that the patient was having pericatheter leak. Okay. So they changed the catheter first time. Next day, again pericatheter leak was persisting. They again changed it. So consecutively, 3 times they have changed it. But the problem does not solve. So what we can do is we can offer another method of catheterization, right? So what will be the best method?
Next, condom method is ma'am.
Or ICC, right? Yeah. Right, so the bladder care, how we can do a bladder care? Catheter should be changed every 3 weeks to 1 month. Okay, so you agreed in your setting also, whenever the patient is having a Foley's catheter, we recommend to use only till 1 month. After 1 month, they have to change the Foley's catheter. If it is a silicone, then silicone catheter.
3 months. Hello. 3 months, ma'am.
3 months. Do you, everyone agree? Silicone it is 3 and for Foley's it is 1. Rubber it is 1.
And wash.
Yes. Okay. So the catheterization should be changed every 3 weeks to 1 month. So mostly we recommend 1 month, and for silicone it is 3 months. And perineal care is very important. Keep the Eurobag cap always closed and below the waist level. Empty the bag until it is 3/4 full. 3/4 full, it is empty. We have to consider it, right? Before that, before filling it full, 3/4 the urine comes into the bag. We have to empty it. Then intake of the fluid, at least 2.5 liters to 3 liters in 24 hours. Observe urine is draining freely, any color changes in the urine or any sediments, and encourage the patient for daily bowel movement, right? So why we are encouraging the patient for daily bowel movement is whenever the intestine is accumulated with the feces, what will happen? Stool, the bladder, it will compress the bladder, right? So if the bowel movement, daily bowel movement will be taking place, the bladder care, we can ensure a proper bladder care, right? Care of the perineum. How we will care the perineum? Perineum should be clean after each act of urination and defecation. Clean with soap and water daily 3 to 4 times and keep the area dry. Clean from the cleanest to the least cleanest area, that is upper to the lower part. Then, and also hand should be clean before giving perineal care, right? So whenever we are doing a procedure to the male patient, we have to retract the foreskin of the penis and then we have to clean it. That is also very important, which is all time missed, right? Right. Then bowel care. Bowel care, that is in a bedridden patient due to lack of exercise, privacy, reduced intake of the food, medications, and that can lead to constipation. So encourage the patient for the bowel movement daily. Give time for the bowel movement. That is very important. Some patients, because of their condition, they won't be having a patience. Give a time for the bowel movement. So we have to encourage them that proper time should be taken for the bowel movement and encourage the patient to take high fiber diet and encourage adequate fluid intake along with regular exercises, right? So bowel care, how we'll do use of bedpan? It is mandatory to maintain patient privacy and use a commode or a lavatory for defecation. If spurious diarrhea. So what is spurious diarrhea is whenever the patient is telling a history that the patient had before 2-3 days the patient is or 1 week before the patient was having constipation, and after that suddenly past 3 days the patient is having loose stool, right? So if the patient is telling this kind of history, that is constipation associated with diarrhea, then that is called as spurious diarrhea, right? So ask the history when it started, before when the onset was there, and what was the condition. Onset was the condition, then we have to, how we will, when we have to identify this, when we identified that the patient is telling that past 1 week I had constipation, after the 2-3 days I'm getting watery stool, right? So if this condition is explained, that is called spurious diarrhea, we have to do a management, that is PRE, per rectal examination, digital manual evacuation, that is digital removal, that is through the fingers we have to remove the fecal matter, and also we have to provide a high sodium phosphate enema, that is also we say it as high up enema. Why? Because already we know that the intestinal pad, ascending colon, descending colon, sigmoid colon, what will happen? Like transverse colon. So what will happen? The stool, the 1 week constipation or 2 week constipation associated with diarrhea, all the stool will be accumulated in the intestine colon region, right? So we will give through a suction catheter, we will lubricate the suction catheter, and we will insert the suction catheter after doing PRE, DRE and all. So if it's a balloony rectum, we'll like while we are doing a PRE, we have certain findings, right? So when we are doing a PRE, we are getting that something airy, nothing is there, and then in the tip there will be a feeling of something is there, or no feeling also. That is, we are going into a hollow like area. So at that time we can we can identify the finding, and we can suggest for the hyperemia. So when we are doing a hyperemia, we have to lubricate the suction tube, okay, and we have to insert it till it goes to the tip transverse colon, and then almost all part of the suction will go inside, and then we have to give two enemas, sodium phosphate enema, right? Right. So these are the procedure which we basically follow here in the palliative care setting, and many other places they are following it. So this is a new way. What I have learned after coming to the palliative care is how to give the higher enema and the findings which we are doing in PRE, right? Next is nasogastric tube. So anyone can tell how we will measure the nasogastric tube?
Nose to
Nose to
neck,
ear loop.
ear to stomach.
Nose to ear, ear to stomach.
Okay, so before going into the nasogastric tube, there is a slight correction. What you have said, we'll do it. Before that, you can watch video of catheterization. Process of feeding with the tube should be inserted through the nose to the pharynx and to the esophagus into the stomach. Right, so there are different types of colors also as per the size, right? Green, blue, black, white, okay, orange, red, yellow, sea green and all. Then whenever we are caring a patient with a nasogastric tube, we have to perform hand hygiene. We also have to give a follows or a semi-follows position before feeding. We have to prevent air entry into the tube by pinching it. Aspirate and make sure the tube is in the stomach before you are feeding. And if more than 50 ml, then skip the feed, right? So whatever content we are extracting or aspirating from the stomach, if it is more than 50 ml, we have to skip the feed. Then the food item is thoroughly grinded and filtered. That is very important. What in the small tube, when you are feeding the patient, if you are not grinding the food particles very well, what that will lead to obstruction of the tube, right? So we have to thoroughly grind and filter the food, and if not, the big particle of the food will obstruct the tube. Every 2 hour feeding, that is 200 to 250 ml homemade, about 225 ml of the plain water. Whenever we do a feeding, we have to give first water, then food, then water, right? Then also before and after the feed, then keep the patient same position for at least 30 minutes. Why we are ensuring or telling the patient to encouraging the patient to be in a same position, that is follows position for 30 minutes?
To avoid aspiration.
Yeah, okay. Or to prevent regurgitation of the food. Why? When the tube is inside the the esophagus splinter will be open, right? So it will be permanently open while we have inserted a nasogastric tube. So whenever the patient will lie out, what will happen? It will got regurgitation and the patient can get into aspiration, right? Or the fluids can go into lungs also. So aspiration can happen. So we have to tell the patient at least to be in the same position for at least for 30 minutes. That is very important. Then oral care and keep the lip moist and change the adhesive tape periodic to prevent the ulcer formation, right? Okay. Hope this session was clear. If you have any doubts, you can ask. Any doubt regarding today's session? Otherwise, one video is also there for easily remembering. We will see how we have to do a nasogastric tube feeding. Think is clear now. So one question Manjula ji has asked, that is for NELCAT insertion, sterilization required or not? So what do you suggest for NELCAT insertion? Sterilization is required? NELCAT, right? ICC, intermittent self-catheterization, right? So sterilization is required. What do you think? Think it, the patient is doing itself, right? So patient is doing itself in the home setting or wherever the patient is traveling, he has been practicing NELCAT insertion. So every time they have to follow sterilization? No, it's just a clean procedure. We have to tell the technique to follow is clean procedure, because we have to be ensured that before doing the insertion, the hands are cleaned thoroughly or washed thoroughly, and then whatever article like NELCAT is inserting, that should be cleaned. If it is a good one, new one, that is okay. If it is reused one, that catheter should be cleaned using running water, soap and water, cleaned it, dried it and stored in a container. That container should be clean. That's okay. Then lubricating jelly and then the NELCAT should be inserted. While we are inserting it, the patient will not be having gloves, right? 30 days gloves you will give. After that, a day, every 4 hourly or 3 hourly, he is doing NELCAT insertion. So he cannot use the gloves. So whenever he is going to insert NELCAT, clean hands. That is hand washing technique we have to teach them. The technique should be clean technique that has to be followed, right? Is it clear?
Okay, ma'am.
Okay. Any other doubts? Preeti is saying no, ma'am. Only Preeti is having no doubt. Rest have doubt or no doubt?
No.
No. Okay, thank you. So hope this session was clear to you. If you have any queries, you can, you are already added in the group. You can ask in the group any queries that will be sorted out, that will be explained to you, right? So thank you so much for joining.
Thank you for the wonderful session. Hope the session was clear. Thank you all for joining and thank you for clearing our doubts in the session itself. Thank you everyone for joining. Let's see the next session.
Thank you.